1st October 1960, a new nation was born. As the green and white flag rose into the sky, Nigeria stepped into independence with dreams of growth, unity, and a better future. Among the many challenges before her was the health of her people. At independence, Nigeria's health sector was young and limited. Hospitals were few, concentrated in cities, and staffed largely by foreign doctors. Rural communities had little access to care, and preventable diseases claimed countless lives.
Historically, as of 1960, the new Nigeria at the time inherited a health system that was designed by the colonial masters that primarily served the interest of the elites at the time, the colonial masters and their friends at the time. But I think as Nigeria began to govern itself, the leaders thought to start to evolve to a health system that served the population more generally, and started to evolve into what seemed like a more community-oriented, decentralized health system.
The 1970s brought oil wealth, and with it, expansion of teaching hospitals in Ibadan, Lagos, Zaria, and Nsukka. The University College Hospital Ibadan became a regional leader in medical education, producing doctors who would serve not only Nigeria but West Africa at large.
In the afternoon, with the officer administering the government of Eastern Nigeria, Mr. Urquhart, Her Royal Highness leaves Government House by helicopter for Umuahia to visit the Queen Elizabeth Hospital, one of the newest in the country. Just over an hour later, Her Royal Highness reaches her destination. The Premier is there to greet her at Government Field, and it seems that nearly all the 35,000 people of Umuahia are there as well. The Premier and his wife are presented, and now the Princess goes to the Queen Elizabeth Hospital. Members of the staff are introduced to Her Royal Highness. The chairman of the Board of Governors, the Reverend J. Jackson, escorts her on a tour of the hospital. There are 180 beds, and 2,000 outpatients are treated every week. In addition, important work is done in the training of student nurses.
The 1980s marked a turning point in public health. Nigeria joined the global expanded program on immunization, tackling childhood diseases like measles, polio, and tuberculosis. Across villages and towns, mothers queued with their children, hopeful for a healthier tomorrow.
Now, between the late 80s and early 90s was when the late Professor Olukoye Ransom Kuti was minister, and he really is who you can consider the grandfather of primary health care in Nigeria, where he enshrined it as part of our health system. And at the time, it was structured such that the responsibility for primary health care lied primarily at the local government level, while secondary health care, the general hospitals, were the responsibility of states, and the tertiary health care, teaching hospitals, federal medical centers, specialist hospitals, stayed under the control of the Federal Ministry of Health.
But progress was not without setbacks. Economic downturns and political instability in the 1980s and 1990s weakened health infrastructures. Strikes, brain drain, and underfunding crippled hospitals. Life expectancy fell, and maternal and infant mortality remained among the highest in the world.
When President Tinubu came into government, there were a lot of gaps in the health system, as many of you would know. Focusing on the primary health care system, there were many infrastructure gaps. There's a lot of complaints. Every Nigerian knows one primary health center that is not in a good state around them. There was a dearth of health workers. Over the last decade, we've had massive exodus of our health workers in Nigeria. The facilities didn't have the commodities or the tools, didn't have power and all of that. And President Tinubu took that head on. He prioritized the rapid reduction of maternal mortality and under 5 deaths as a priority for his government. And he was, aware enough to recognize primary health care as really fundamental to that. And he really latched onto that, called the governors together, signed a compact anchored around the health sector renewal investment program, which he put the coordinating minister for health, Mohammed Ali Pati, at the helm of that to drive the implementation. But it was really the vision of the president to serve every Nigerian in this country, wherever you and I live and whoever we are, to guarantee us access to the basic services that we need.
Nigeria confronted the HIV and AIDS epidemic head-on, establishing the National Agency for the Control of AIDS, while global partnerships ensured millions received antiretroviral drugs. In the 2010s, Nigeria achieved a milestone: the near eradication of wild polio, celebrated worldwide as a triumph of persistence and community action.
So on wild polio virus, Nigeria was in fact the last frontier on the African continent. There are a couple of countries, Afghanistan, Pakistan, that have not completely been eradicated, been free of wild polio. But you see, Nigeria was where everybody was worried that, would be a hindrance to eradication of polio. But like I said, between 2016 and 2022, through very concerted efforts, we were able to go in the front line at the height of the Boko Haram insurgency. We were working, I was part of the work at the time, even though in a different role. And we were partnering with the military, partnering with communities, partnering with everybody who would support us to reach every child. And we were able to get that out. And Africa was certified wild polio free, with the last case that was found in 2016 in Borno.
When Ebola arrived in 2014, swift detection and containment made Nigeria a global example in epidemic response. The COVID-19 pandemic tested Nigeria's resilience once again. Laboratories were upgraded, local vaccine production was pursued, and health workers rose as frontline heroes, saving lives under extraordinary strain.
Look at the COVID-19 pandemic as well. It really shook the world, and it shook Nigeria as well. But I think everybody recognized that Nigeria's response at the time, was superior to even many of our richer counterparts that we look up to for guidance. Nigeria had structures in place that were able to mobilize very quickly from a government perspective. The NCDC, this agency for vaccination, even our private sector really rallied around and stepped up and took responsibility, and invested quite a bit. And so the impact that the COVID-19, and many African countries followed the example of Nigeria at the time. So the impact that the COVID-19 pandemic had on the African continent, and in Nigeria specifically, were very, very reduced.
65 years after independence, Nigeria's health sector stands at a crossroads. Advances in medical training, the rise of private hospitals, and the growth of telemedicine signal progress.
I want Nigerians to know that President Tinubu is coming through on his promise to Nigerians to deliver high quality basic health services that we trust to all of us. If you look at the push on revitalizing the PHC, you look at the investments in health workers, look at the infrastructure upgrades, equipment, buildings, cold chain, power, you look at commodities that are going out there, the things that you need. We look at insurance coverage that is going up. When you put all of this together, I think we can be happy and proud of what the government is doing under the leadership of our president, and know that we're on a journey. It's not an overnight journey, and we recognize that we're not yet accomplished everything that we should accomplish. But I think the progress is tangible, verifiable, and touching Nigerians.
From independence to now, the story of Nigeria's health sector is one of struggle and resilience, of setbacks and triumphs. It is a journey not yet complete, but with each generation, the dream of a healthier nation lives on.